Good evening and welcome to League of Women Voters Presents. I'm Jim Robertson, and our topic tonight is heroin, meth, and the prescription drug epidemic. I have a very interesting panel tonight, and our guests are from my far left, Leigh Spence. She's Director of Counseling at Battle High School. Jason Jones is with the Columbia Police Department. Jared Torbett is a licensed counselor at Phoenix Health. And Luke Buffaloe is a physician at MU Health, correct? We're going to talk about the fast rising epidemic, the CDC has termed it, of prescription and opioid drug abuse and overdose. In Boone County, CDC reports between 14 and 16 deaths per 100,000 of toxic drug overdose or drug poisoning. And that's a pretty high, compared with other counties in the nation, it's on the high side. Heroin overdoses nationally have tripled since 2010. So we can look at the numbers and see that there is something going on there, an epidemic. I'm going to go first to Jared Torbett with Phoenix Health. He works with addicts and folks in need.
Yes.
And you were talking earlier, Jared, about some trends you've seen over the last few years. Can you talk about that a little bit?
Yeah. There's so several years ago, we kind of started noticing a little bit more clients coming through the front door for drug and alcohol treatment that came in claiming that they, were struggling with an opiate addiction of some kind, whether that was pills, heroin, and then we've seen kind of like a rise in that, just from our perspective as people are coming through the door, and that has kind of risen in the last several years from about 5 to 10% initially, to now well over half. In fact, the majority of the clients that come through the front door of our clinic for help have list opioid as one of their primary drugs of choice that they use.
Do you believe that is like a better reporting, or is that a drastic increase in the number of people who are affected?
Yeah, I think it's both. I can definitely understand how there might be sort of a stereotype or a stigma of being able to come through the door and openly say, yeah, I've been using heroin. At the same time, I think probably it's more that the use has increased, because we're not only hearing our clients say now that like more prevalent use of heroin, but we're also hearing clients say that they started using heroin, a few years ago or several years ago. So we're seeing these trends not only in like intake data from when clients come in, but we're also, as we're having discussions with clients and what's going out on the street and kind of in their world, that there is an increase in the availability of opiates on the street, in the form of heroin primarily. And that the cost of that has gone down quite a bit. And so people are sort of switching over to that if they haven't already developed an opioid addiction yet.
Yeah, so I guess that supply and the low cost really contributes to a growing problem. Leigh, you work in the schools. What do you see as far as the kids go?
Well, I think probably district-wide, heroin definitely is something we're aware of. I have a friend who has experienced this with her family, and I know that this year they have gone to 3 memorial services for young people that they know. So it is definitely something in our community. I think for the kids we work with at Battle, and I say I have to knock on wood every time I say this, it's not something that we've seen as much in terms of kids talking about heroin. We do see prescription drugs, we do see alcohol, pot use continue to be the ones that kids talk about the most. And of course, our belief as counseling staff is that all of this, we see more mental health concerns, more issues with students with anxiety and depression, which I think makes them more open to the idea of trying something to make themselves feel better or more confident.
You know, we hear about the high-profile deaths of young people because of heroin overdose or whatnot. I mean, the police department deals with some of that.
Sure.
But then you see the obituaries of young people that there's no reason that they died, and you wonder. You always wonder.
Yes.
As far as enforcement and interdiction, how effective is that in stopping this population from?
Sure. Just like with enforcement of any other drug, it can only go so far. And one of the things that you constantly hear, and I think there's a lot of truth to it, is you can't arrest your way out of a problem like heroin. And so you've got to look for maybe some other ways of dealing with that. So I think it's a great thing that we have the resources that we do here in Columbia. A lot of places don't have the luxury of having some of the treatment facilities that we do. So I think it's a great thing that we do have the Phoenix House here and the doctor here that can attest to the resources that we do have for that kind of thing.
Dr. Buffaloe, tell us something about your experience in this world.
Yeah, so I've been treating patients with opiate addiction and other kinds of drug addiction for the last couple of years. And over that time, we've really been able to recognize this as a very serious problem, as an epidemic, as many people are calling it. You mentioned those statistics about the number of people who are experiencing overdose deaths and the rise in overall use in opiates. And we're actually at a point now where the number of people who are dying from opiate overdose is actually exceeding the number of people who are dying in motor vehicle collisions. And I think a lot of people are very surprised to hear that this is a problem that has reached those kind of proportions, but it really is. In the time that I've spent treating patients who have had this problem, I've seen increasing numbers of patients who are seeking treatment, and I've seen a general trend towards more serious problems. People graduating from using prescription painkillers to using heroin over time.
The New York Times back in January, I think I read a story that likened the increase in this epidemic proportions to the AIDS epidemic in the 80s. And of course, as a country, we had a pretty serious campaign to make people aware and educate people about AIDS and develop drugs and kind of got on top of that problem a bit. It didn't go away, but what will it take, and I want to hear all of your perspective, to get people focused on this drug epidemic to take the same kind of action?
I'll speak to that. I think this is a problem that, unfortunately, we're having to play catch up. I don't think we were getting on top of this or recognizing this as soon as we could have. A lot of this drug use is being driven by just the amount of opioid pain relievers that are available. So over the last 20 to 25 years, doctors have prescribed pain relievers in much larger quantities than they had historically. And unfortunately, a lot of those medications are either being abused by the patients who are prescribed them, or they're making their way onto the street. And that has really driven a lot of this epidemic. Physicians are now recognizing that this is a serious problem. And we have major organizations like the CDC and the FDA who are making recommendations on more appropriate patterns of prescribing these medications so that hopefully we can stem this tide.
Jason, are the drugs that the police department encounters, are they mostly the illegal heroin, or are they prescription drugs, or is it an even mix? Or
Yeah, we have, unfortunately, we have drugs here, we have the heroin problem, we have the prescription drugs, we have methamphetamine. I mean, unfortunately, we have all those drugs here. Just like Jared was talking about with roughly the last 5 years or so, that's been our experience as well, that 5 years ago we rarely had any enforcement with regards to heroin arrests. And since then, it's just started to slowly creep up. And we really noticed a peak in 2014 of our drug arrest for heroin, our drug arrest for opiates, illegally possessing the opiates. So I would say just what Jared described is also what we're seeing as well.
And it's a mixture of the heroin, street drugs, and prescription drugs.
Yes, yes.
So, well, do you, Jared, when the people come to you with the problem, the drug problem, how do they explain how they got from where they started to where they are now, and what might have turned them earlier?
Yeah, it's a good question. We do hear a lot of traditional stories of I had an injury, I went to my doctor, I got put on pain meds, and then I got addicted to them. And then, and typically we find this in people that claim to have more chronic pain, like ongoing pain. So, they have an operation done, they get some pain meds, and then once those pain meds are gone, then maybe they're fine. But something that goes on a little bit longer, to where they're on those medications a little bit longer, they have more of a likelihood to start to develop some kind of an addiction to those. And the problem starts to set in whenever the medication that they're taking, as prescribed, no longer has the same effect because they're building a tolerance. So then they start to maybe kind of play games with their meds, like maybe take a little bit more. Well, then they short themselves later. And then they need to get more. So typically they'll try to get more from the doctor. And, everybody loses a bottle of meds now and again. And sometimes they might be able to get a little bit more through that, but the doctor's going to catch that pretty quick. And then ultimately, those pain medications, they start finding them on the street, which they're readily available. But they're very expensive in comparison to heroin. So eventually, most will just kind of make that leap, from pills to heroin. And it's interesting because I hear people say that have a really expensive pain pill addiction, that they'll say things like, they're kind of proud, like, oh, I've never used heroin. I would never do that. So it seems like there's kind of this stigma, right? That it's kind of hard for them to sort of like step over that, but eventually their addiction will cause them to.
Yeah, and I think that's a really important point. There's this perception of safety with these pills. These are medications, so people can sort of fool themselves into believing that these are okay to be taking. And for a lot of people, there is that they don't want to take that step to using something like heroin. They don't want to take the step of injecting a medicine or a drug because maybe that's a line that they just don't want to cross. But those pills, in spite of that perception of safety, can be very dangerous.
Well, and I think probably the more educated you are, the more you assume people understand the gravity of the nature of something that they've been prescribed. But I think a lot of times for families, the doctor told me to take that, so it must be fine for me to take that, not understanding that there are ways in which it can hurt them. And I think if you're an educated person, perhaps you've read about those things or you're more aware, but if that's something that's not on your radar, and your doctor said it was okay, then sure, I can probably give that to my kid who has a hurt arm or something, not understanding that that's not something you would ever want to do.
Or, another example is not even the person that's prescribed the medication, but a young person sees that medication in the home and they take that, experimenting with drugs, and that can be the first step to this addiction.
Right.
Well, what I'm hearing is that You know, I used to think that the drug people who got into trouble with drugs were using them for recreational. Everybody starts with some kind of pain, whether it's psychological or physical,
Exactly.
and that, you know, in the old days, in the 70s, you know, there was all kinds. There was heroin, there was pot, there was cocaine, there was MDA, there was all kinds of LSD, you know, and that was more of a college pastime maybe. And what I'm hearing now is that people are starting with injuries, and there's more addiction starting from that perspective. Is that true?
And I would say that certainly there are people who are becoming addicted as a result of being prescribed these medications, whether it's for a short period of time or over a long period of time. But I think it's definitely still the case that people are using these medications purely recreationally. So not everyone is starting off with a legitimate prescription for these medications. But for many teenagers, many people in their college years, they may be using opioids as one of the many recreational drugs that they're using, along with cocaine or along with marijuana.
Leigh, what are the schools doing to educate and to intercept?
Right. Well, you know, it always begins with educating ourselves. So we do have a number of professional development offerings for our counseling staff and outreach counselors who are our social workers in the schools. But then talking to the kids about it. But, you know, I think for us, what starts out looking like a kid being depressed or disheveled and not looking like themselves, looking, you know, they're sick all the time, they're missing school all the time. And so for us, it starts out looking like, you know, depression. And so just trying to piece it out is a challenge for us. And certainly the kids receive lots of information in their classes, in their health classes, in their science classes, in their popular culture classes, but you know, every teenager and most adults will say, oh, well, that thing's not going to happen to me. You know, that happens to somebody else who doesn't have the self-control that I have, or, you know, that's not the kind of person I am. So they don't see themselves in those most extreme examples. And I think, you know, what's helpful to them is when it's the less extreme examples that are presented to them, and ways in which you can take a wrong turn. But it's challenging as schools, but we certainly can tell that something is awry. It's just figuring out what it is.
So walk us through the process if you suspect that someone's having problems.
Typically, you know, it's often an attendance issue for us, like kids are not coming to school, or they're skipping school, or they're falling asleep all the time in class. And so they send them down to us to see what we can do with them. And, you know, it's often a series of conversations. It's not like they're going to come in and say, guess what, you know, this is my problem, and I'm dying to tell you about it. You know, they don't want to talk about it, and they definitely don't want to rat out their friends, and they don't want to say where it came from. But sometimes it came from grandma's medicine chest, or, you know, wherever their access point was. But for us, it all starts for us, I think, in setting the kind of atmosphere that kids can come to us and they don't feel like they're in trouble or that we're going to take a turn. But we always tell them, if you're in danger, we have to tell your parent or your guardian, whoever cares for you at home, because, you know, your safety is very important to us. And so we always have to go at it from that perspective. We can't say we're going to keep your secret, which is really what they want us to say. But if they're in danger, we certainly can't do that. But we try to make them understand that we do that because we love them.
So I guess it's about building relationships with those kids.
Yes, and because, you know, we do have some excellent providers in our community and excellent relationships within the community, that we can help families at least point them in some directions of where they go next, because it's often, of course, heart-wrenching for families to know that their child's struggling in whatever way they're struggling. So.
Sure. Jason, there used to be DARE programs in all the schools.
Yes.
I think those have gone by the wayside, haven't they?
Yeah, I don't know what the percentage of jurisdictions are that still have the DARE program, but yes, we don't have it locally anymore.
Right. It was at times controversial, and
Right.
People questioned its effect.
Sure.
As a police department, I know that community policing would sometimes get to those sorts of problems,
Right.
And we are maybe not at a point where that can be effectively
Sure.
deployed. But what does the police department do when they encounter kids in particular and people in general who obviously have a problem and need help?
Sure. Like we talked about before, there are some good resources. And unfortunately, right now, a lot of times people do get arrested and do get put into the criminal justice system. And so that's one way they're introduced to the treatment that we have available in Columbia and in Boone County, be it the Phoenix program, be it the drug court, which is a great program that we have access to here in Columbia. So, particularly the problem with heroin, what we as a police department and the narcotics unit can do, and what we try to do is, given the impact that it's having on our community, is we make that our priority, is the distribution of the heroin that's causing some of the deaths that we're seeing and causing some of the problems. So that's from a police department's perspective, one of the things that we're doing. You asked, how do we move forward from here? And I think exactly what we're doing here today is talking about it with the different groups and the awareness, making people aware of the problem, and coming together and saying, okay, what resources do we have available to us, and what can we do from here, as opposed to, just doing what you've done in the past.
Right. Well, let's use our remaining time here to talk about, number one, success stories, and number two, what do you recommend people who might be watching this tonight, if they they're having difficulties, what should they do? How do they get in the system?
Yeah. Well, contacting a treatment center, for one.
I know you said insurance is sometimes problematic.
Yeah, it is. Insurance companies are difficult to deal with, for us organizations that try to bill in a variety of ways, and we do work with insurance at Phoenix Health Programs. We do accept insurance, although we find that we're sometimes we kind of battle those insurance companies a bit, and those insurance companies typically don't want to pay out a whole lot for treatment. So that in itself is a barrier. I mean, their coverage is a barrier to them getting help to a degree. And then paying out of pocket gets very expensive, and a lot of families can't afford that. If the household income is a certain line or below, then there's state funding that kicks in that will pay for all treatment. And in fact, that kind of treatment is a little bit more flexible, even because we bill as we see fit. So that would be kind of a first step is contacting a substance abuse clinic like Phoenix Health Programs and doing a phone screening, and then that phone screening will kind of tell us whether that person is appropriate for an assessment, a full assessment, and then that's when we look at kind of an array of different areas of their life, and how their substance has impacted them, and because they might need help above and beyond just substance abuse treatment. They may have a mental health disorder, something we call dual diagnosis or co-occurring, and they may need housing. They may need sober living. There's a variety of things they might need. So there's a lot of success, and we have clients that are on Suboxone. We have clients that are not on Suboxone, and the ones that are on Suboxone do really well. Now, unfortunately, a lot of times when somebody is on Suboxone, then their discomfort is removed, and therefore they might not have quite the umph to work in treatment. So then when they come off of Suboxone, they're kind of back where they were before. So it's important for a Suboxone program to really encourage, a recovery program to be successful overall for that client. Yeah.
Look, there's a way out of this dark place.
I think there is, and I think you made a lot of good points. I think for a lot of people who are having these kind of serious problems, or if you have a family member or a close friend who's going through these issues, referring them or at least making them aware that there are treatment options available is important, and being able to give them the contact information for some of our local programs is important. Ultimately, they're the one who's going to have to make that decision to seek treatment, but at least making sure that they know what kinds of options are available is very important. For many people, rehabilitation services, or for some people, medication-assisted treatment can really make a significant difference. And I've seen patients who have done extraordinarily well.
Well, thank you, panelists. That was a very interesting topic. And I think it's important for those who are watching us to know that this is a rich environment to get help if you need help, and just ask for it. Thanks for joining us tonight, and thank you. Until next time, goodbye.